The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Warning. This video contains rapid flashing images that could potentially trigger seizures for people with photosensitive epilepsy. Viewer discretion is advised.
Hello audience, I'm Dr. Fazil. Today we're going to talk about a new topic which is a new health concern in the United States of America, USA, monkeypox. This is July 2022 edition of Dr. Fazil Show. Welcome audience to my show. As I said initially, the topic for today is new medical condition which is spreading out in USA at the moment, monkeypox. By the way, before I go further in my discussion about this topic today, we have our two robots. You can see your right and left side. They are, we'll call them Alpha and Beta. They are actually here today as an anchor. Hello, Alpha. How are you doing today?
Doing good. How are you today?
Doing good. And Beta is doing okay?
Doing great. Thanks for having me.
So those robots are actually going to ask me some questions at the end of my discussion at the behalf of the public. So here we are. So let's talk about the monkeypox. So monkeypox is kind of misnomer. It is not always spread from the monkeys. Most of the time it comes from rodents like rats. Monkeypox is a viral infection. It's not a bacterial infection. It's come from viruses. So basically, going back into the history, it's originated from Central Africa, from country of Congo. And then it got spread to West Africa, like Nigeria. And that's where mostly is spread or is kind of based into those two countries. But then it started to spread out from there to different countries like Spain and United Kingdom, USA, Canada. And when it spread to USA, then we got concerned. So that's why we're talking this topic today. It's not a new infection. We have some cases in 1970s. It was initially discovered in 1958. It's a virus which is known as RNA. It's a DNA virus. Like COVID virus is an RNA virus. Monkeypox is a big virus. It's a lot bigger virus than COVID virus. It's a DNA virus. It originated from monkeys, but it also lives in rodents like rats. So how did it come from Africa to the different countries? Apparently, when they imported those animals from those countries to different countries, and they were already infected, they got transmitted to these new locations. So generally, it is an animal disease. As I said, it's known as zoonosis. Zoonosis means a disease which is common in animals. But when you get those disease from animals to human, we call it zoonosis. So it's an animal disease which has been spread to human beings. So mode of transmission is direct contact. So when you get monkeypox, it's like a chicken pox. We know that chicken pox is gone from the world. We haven't seen any new cases for a while, for many years. So that's why people who have got chickenpox vaccine, which are mostly patients or people older than age 50, they mostly have got chickenpox vaccine. They don't get it. So that's why the new cases for monkeypox we are seeing in patients less than 50 years of age, because they haven't got chickenpox vaccine. They are younger for getting chickenpox vaccine. Generally, it is being seen in bisexual or gay men. That's where it is mostly prevalent in out of Africa. Generally, it's spread through intimate contact. It's not a sexual transmitted disease, by the way, but by intimate hugging, kissing, it can spread. It can also spread through infected clothes, linen. So that's the mode of transmission. So primarily, it is if somebody have a skin rash due to monkeypox and you touch it, and that fluid gets transmitted to your mucous membranes, nose, mouth, you will get it. Incubation period, that means when the time you get exposed to the time you get symptoms is 7 to 2 weeks. 7 days to 2 weeks. 1 week to 2 weeks. Symptoms are typically flu-like symptoms, like you get fever, chills, body aches, muscle pains. Then lymph nodes become swollen, like your throat, the glands behind the throat will become swollen. And then you will have a rash. Rash could be anywhere, mostly in the face, on palms, feet, or anywhere in the body can happen. It become like little fluid-filled rash, then it become blistered out, and the fluid come out, and then generally it gets better by itself. 10% people can die if they get infected. So we have to be careful. The treatment is available. If somebody gets really sick, there's some antiviral medication which can be used, and that treatment is for twice a day pills for 2 weeks, and then you're done. But when people get symptoms, the recommendation is to have them quarantined for 2 weeks so they don't spread the infection to somebody else. And now people are talking about vaccines. So vaccines available, which has the same kind of makeup as they had for smallpox. And they're, generally the vaccines are 2 shots, 1 month, one vaccine given today and 1 in 28 days. So that's what the vaccine is all about. So we talked about treatment, we talked about the vaccine, we talked about where it came from, we talked about symptoms and the mortality rate and what kind of demographic it's getting. So we're seeing mostly right now in the Bay Area and in New York City. That's why there's a push to get vaccine for certain demographic of the patients with the high-risk behavior. For example, as I said, bisexual men or gay men or are the ones which are predominantly the target for this virus because the way it spreads, So that's kind of like the nutshell. In the nutshell, that's all about the monkeypox, what you need to know. So if you get a rash, if you have been exposed to high-risk individuals, and if you got a rash, if you think of monkeypox, contact your doctors or public health agencies, and they can help you out to how to treat it. As said, it doesn't have to come from monkeys. It does come from rats and certain kind of dogs, which has been exposed to that virus. So it can jump from animals to human beings by direct contact, sometimes also by droplet infection, but it's not as contagious as COVID-19 infection is. So you have to have a lot of droplet infection at very close proximity for a long time to get through respiratory means. Generally, that transmission is through direct skin contact. So that's the end of the discussion. From my perspective, I think my audience would now be more educated on this thing. It's not a big thing at the moment, and I don't think it's going to be. So don't be scared, don't be alarmed. It's kind of rare disease, has been there for many, many years. It's treatable. So I know the social media is making it a big deal, but it's not. So I just want to let you know that. So let's focus on other important issues. It's not the big issue at the moment from my perspective, and I think from our demographic perspective. So, but it's good to know. Well, all they say, things which you don't know can kill you. So that's why I thought it was a good idea to have you know about this thing. So now you know. So now we're done with our discussion. So let's ask our two robots anchors, Alpha, Beta, if you have any questions. Alpha or Beta, if you have any questions, please do ask. Thank you so much.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Should everybody get a vaccine just to be safe?
Well, that's a good question. So not everybody should get vaccine because, as I said, it has only few cases in the USA. It is not very highly contagious. It's treatable. It's not very deadly, and also, we know that vaccine does have side effects. So unnecessarily getting vaccine would not be a good idea. Idea is that if avoided, if you see somebody have skin blisters, try not to have intimate contact with that person till their blisters goes away. Again, if you're in a high-risk population, for example, as I said, bisexual man or the gay men are the one who are getting at the moment. So if you're not in that category, I hope not. But then if you are, then you should get it. Otherwise, not.
Does wearing a mask offer any protection from the monkeypox virus?
Well, the question is a very good question. That now we are into the mask era. Everybody's talking about the mask from flu, from the pollution, from COVID-19 infection. Masks have no major role in protection. Again, a droplet infection spread of monkeypox is the least of the way of transmission. It gets transmitted through direct skin contact. And it takes a long time, even if you have a droplet infection. Around 3 hours you have to be exposed to droplet infection to get it. So therefore, you cannot be walking in a grocery store and get it. So there's no point of using a mask for this particular infection. So Beta, you can take off your mask, by the way. If you're putting the mask to protect monkeypox, that's not what you need. But you can keep it on. I know you like your mask, but this mask is not shouldn't be used for monkeypox.
Yeah, I figured better safe than sorry here.
Yes, I understand that. That's a good comment.
Did you say that there is or there is not a vaccine?
So the question Beta asked about if there's a vaccine available yet or we're still making it, I think the question is rooting from this fact that when we have COVID-19, we were aggressively in the phase of making vaccine. Now we have already vaccine for this virus. This virus is not new. It was first discovered in 1958, and we have been using vaccine since then. The vaccine has same features as for smallpox, so we have vaccines. You can use that vaccine. There are 2 shots available. You take 1 shot in one, and then in 28 days you take second shot. So vaccine is available. I know there's a big fear factor on the social media. People are standing in line and they're demanding for a vaccine and stuff like that. But as I said, this is only in a certain clusters. It's very difficult to transmit because if you see a patient who have a rash, you automatically going to stay away from that person. So it actually stops in its own pathway. Unlike COVID, where you can have infection and you don't even know and you're spreading it, and people are coughing and sneezing at each other, and it's very contagious, the COVID-19. So that's why the mask is important. Vaccine is so much important on that kind of infection because that's so contagious, but this is not that contagious. So you will have to ask to get this infection. You can't just get it. I mean, literally you will have to rub your body parts and hands and stuff on the infected skin lesions. And I don't think most people want to do that. So I think vaccine is only necessary for very high-risk patients in very high-risk areas, and like in New York and San Francisco.
If I did have a rash. Should I assume it's monkeypox and self-isolate like I did with, or like individuals did with COVID-19?
So Alpha, I have a question that if you get a rash, then we automatically assume, since it's the time everybody's talking about monkeypox. So no, you can get rash from multiple reasons. You can get rash from allergies. You can get rash from other infections, cellulitis, infection of the skin by itself. So unless you have been exposed to a very high-risk person, and the rash of the monkeypox looks very different. I mean, it is like a fluid-filled vesicles, which are most in the face, on the back of the hand, and then you should have exposure prior to that. And if you didn't have the exposure and you're not in a high-risk category, and your skin rash does not look like balloons of pustules, then you shouldn't be worried about that. But do ask your doctor. I mean, this is just always a wise idea. But again, not every rash nowadays would be monkeypox. It could be, but the setup has to be the right. Not every rash is monkeypox. Good question, Alpha.
And so, just coming out or getting used to the new normal with the COVID-19 virus, a lot of us are pretty scared, seeing the headlines of a new virus coming out.
Oh wow. Okay, so Beta's asking questions about the COVID-19. So we're switching gears from monkeypox to COVID-19. So yeah, that's true that we are seeing a lot of new patients of COVID-19. The Omicron new variant is out there, and the BA variant, which is more contagious. It is not actually effective to the vaccine, and it is a lot more contagious. So it's a lot more infectious virus now, because this new variant knows what vaccine we have been using, so it is bypassing the immunity. If you already got a vaccine or the COVID in the past, you can still get COVID from this new virus, and it's a lot more contagious than the previous one. So we are seeing a lot of new cases, like in Europe. Like in Italy, they were having 1 million cases every day. And there's hospitals and clinics are full with COVID-19 infection. Even in Arizona, we are seeing patients with COVID as well, right and left. It's not something we're not seeing that much actually on the that news on the media now. And there may be a reason that people are sick and tired of listening about COVID, and they don't want to hear about it. But it's out there actually. It's more out there than it was in the past. And I think one of the reasons a lot of countries do not want to talk about it is because they do not want the travel bans, they do not want the lockdowns, because when there were lockdowns in the last 2 years, we already seen the financial disasters. And a lot of countries are dependent on the tourism for their social and economic situation. So even though it's out there and people are getting sick, but they're and now I call them in a denial mode. They're in denial mode at the moment. So unless you drop that in front of them, they wouldn't care much. That's the way I look at it. So you have to be careful about fake news and the news out there, which is not really real, because it has so much reasons not to be real. Before it was too much push about COVID and COVID, and now you have a lot of COVID, but you don't hear it, but it's still there. So take my word for it, please. Thank you.
So can we be set at ease a little bit that the monkeypox virus is not going to spread and take over as COVID-19 did?
Oh, yeah, I don't think we're going to have that Planet of Apes situation here. Yes, I mean, I don't think that's going to be the case. Again, it's a high-risk patients in high-risk areas, and it's not a new virus. It is, by the way, it has been used as a bioterrorism in the past. It has a potential as a bioterrorism. Yes. So besides that, I mean, unless somebody literally want to do it, then it will become an issue. But it's the natural history of this virus is not very infectious. It's not like going to jump and get so many patients. But again, it has been used like a chicken pox, It has been used, it could be potentially used as a bioterrorism weapon. So we have to be careful with that. If that happens, then we know it's not normal or natural, then somebody is intentionally doing it. That time, if that comes in question, then definitely that will be a whole new ballgame. I hope that doesn't happen. But we are in a different, environment now, new era, you can see, I mean, things are different. Warfare, the platform have changed, you know, the cyber hacking, cyber attacks, and biological warfares, and those are new tools of modern weaponry. It's more deadly, more cost effective, I guess. So we have to be very vigilant. So it's always keep your eyes open and watch your back. Good question. I think my anchors asked very good question today. So since they have no more questions, so on that note, we will call it a day. Thank you so much for listening to our topics and discussions, and stay tuned. I'll be back next month with more information for you guys, and have a nice day, and God bless you. God bless America. Thank you. Dr. Fazil here.